Aloha, it's Jill, the Barefoot Grandma. This is my second video in my cancer series, and I did watch my first video, and I could tell it was my first video. I could tell I was a little nervous. It was a little bit long, so this time I'm going to try to move it along a little bit. Each of these videos are really going to be standalones so that people can watch on a topic-specific set of stories and points and tips and enjoy them in shorter bites. Today's video is about treatment, and my first video was about diagnosis. So I do remember when I was going into treatment, my oncologist told me that, we just need people to stay alive 10 more years, that cancer therapies are going to improve dramatically. And he was right. Actually, from 2016 to 2017, the introduction to new chemotherapies, I believe there were 18 that year, and then 13 chemotherapy or therapies. I don't know if they were specifically chemotherapy, but 13 therapies were also cleared for different uses. So it broadened their ability to reach other types of cancers. And in addition to that, the response rate for cancer treatment and the therapies that were given really increased as well. And so if you have to have cancer, today is a much better day to deal with that than it was 20 years ago, and then was even dramatically better than 20 years before that. So, as time goes on, research is so important, and therapies improve. More types of therapies for more types of cancers become available. Clinical trials are incredibly important. And it's kind of on that note that I have to take a side avenue here. I'm really angry about recent news that our president has taken $260 million away from medical research, and a part of that, cancer research specifically, to fund the incarceration of the immigrant children that he doesn't know what to do with. And, if I felt like the money that was going into cancer research was going towards something positive for these children, I wouldn't have a problem with it per se. But that these children shouldn't even be in this situation, and you can agree or disagree with that. That's my own personal belief. I think it's heartbreaking. I think it's wrong on so many levels. But now there's a double injury and insult that to cover the cost, we're taking money away from increasing people's ability to live and to survive deadly diseases, and it's just a travesty, in my opinion. So that being said, though, going back to cancer treatment and mine specifically, the treatment of cancer generally it falls under the umbrella of oncology most times, and there are specialties within oncology. Most of us have heard medical oncology, radiation oncology, but there's also surgical oncology, pediatric oncology, gynecological oncology. There may even be some more specialties. And each of those, each of those areas have specially trained physicians and nurses and staff that treat patients in those areas. My particular protocol required, and that's what I'll talk about today, is kind of the first set of treatments that I had, and that was chemotherapy called adriamycin and Cytoxan, or otherwise AC as it's known. I'm not even sure that they use Cytoxan anymore. I think they've veered off to other similar drugs, but maybe they do. I don't know. I had six doses every 3 weeks, and intervals of every 3 weeks, because it kind of takes you that long to rebuild your system and recoup so that you're strong enough to get the next dose. In preparation for your treatment, or for my treatment at the time, and I'm sure they probably still do this, the patient usually has a blood test either the morning before treatment, or within a day or two prior to that, to get blood counts and to see if to make sure your white blood count hasn't dropped, or that you're potentially not looking at an infection. They want to make sure that you're healthy. And so then the day of chemotherapy, I would go in and I would first get some anti-nausea medicine. That may be the whole nausea thing. Excuse me. The whole nausea thing may be a separate video, but so starting with anti-nausea medicine, and then the chemotherapy itself, and then they would follow that up with a saline flush to make sure that everything was, your veins were cleared out. And I actually, my veins just suck. They're small veins. They like to roll and move, and they're very hard to find. Frequently, I've had them go into my hands for like an IV of some sort. Generally they like to go here, but they have a really hard time finding veins here. And then the other thing, because frequently they go in my hands, veins will blow. And so I opted to get a port, and probably the best thing I ever did. And that actually, you can see it right here. That's the scar from it. And they surgically insert the port and thread it into a vein. And then when they do your infusion, it's super easy to access. They flush before, they give you the chemotherapy, and then they flush after, and you're done. There's no bruising. I will say that when the port came out at the end of all of my chemotherapy, you can kind of tell it's a little bit, the scar ended up being a little bit big. I had to go in and have them take out some scar tissue because it wasn't healing right, and because it was in my bra area, it got rubbed a lot. But all of that inconvenience was well worth the convenience of not being shot in my hands and arms and bruises. And what I will say, though, the chemo nurses are about as talented as blood drawers and IV setters of anybody. I mean, if you've got to have blood drawn and you have a hard time, find yourself a chemo nurse, because they're just amazing. In surgeries after that, because my veins were kind of whacked, I even had them have to go into my feet. So I really appreciated the port. And then, unfortunately, all chemos come with side effects, and AC is notorious for nausea, which I had very intense nausea. Anti-nausea medicine, none of it helped. So I got no relief from that, and I'm unusual in that case. I know there are other people that have suffered like I did with no relief from anti-nausea medicine, but for those that do, be thankful that it does help. Flushing, my face would get really red, and actually my last chemo was my worst. The medication builds up in your system to attack the cancer, and by that sixth dose, my face got super red and swollen, and it was so painful. My cheeks, I just remember crying, and that was my worst, probably the worst moment in the treatment aspect of it. I kind of hit rock bottom and had to do a lot of dialoguing with God about where I was at and going forward. But it passed. But also hair loss. I'm going to do a separate video on hair loss. I think that deserves its own time period. I got some cardiac damage, AC. I don't know if it's adriamycin or the Cytoxan or the combination of both that can damage your heart. It did damage mine, but the good news is with time it healed itself. Had a horrible metallic taste in my mouth for a long time. So just you get so thirsty, and water just tastes nasty. Many of the foods that you've enjoyed in the past taste nasty. You're sick, you don't really want to eat, but then when you do kind of want to eat the food, you don't get the same enjoyment. So that was actually one of the worst ones for me, was the metallic taste, and it lasted a long time. It didn't go away immediately after that chemo. So, and then I also went into chemo-induced menopause. So in addition to everything that was going on, I also went into menopause at 39. So hot flashes and hot flashes and hot flashes and lots of hot flashes. In some ways, I think I might have got off easy, because I was already going through so many symptoms of the chemo that it probably just mostly got lost in it. And by the time I came out of cancer treatment and dealing with this, in 18 months, 2 years, it was pretty much over with. I still have some issues with it, but not that, 20 years later, you still get to deal with some of that side effect stuff. But for the most part, I dealt with the worst of it in the middle of cancer. I will give you a tip. If you know of somebody that's in the middle of chemo that gives them intense nausea, or you yourself, I found a weird little trick totally by accident. I was, obviously in the bathroom a lot, and in between bouts of severe nausea, I'd run the cold water in the faucet, and then I'm weak, and so I would lay my head on the faucet, like with the faucet like right here. And I realized accidentally, if I ran the water super, super cold, and then I put my forehead on that faucet and just sat there, it really dialed down the nausea. So I thought, okay, well, I can do that in bed. I can put ice cubes right here. Well, that wasn't the same. So I believe that it was a combination of being bent over and the coldness. And so when I would start to get really, really sick, I would actually, before I had to vomit or anything, I would actually go in and was able to mitigate some of it by doing this little trick. So I highly recommend somebody trying it, because maybe it'll save you a little bit of grief. Funny side story on the whole nausea thing. My oldest son and his wife lived on the property with us at the time, and they were very much into eating raw. For those of you that are unfamiliar with raw food eating, it is as it would sound. You only eat food completely raw or warmed at a very low temperature. And so they thought they were going to do me a great favor and take care of me and give me lots of healthy food. And this was my very first chemo, mind you. So they made me all this raw food, all really healthy, and I thought, okay, well, it's healthy, this is probably good for me. I'm going to do this, enjoy my last meal, if you will. So I ate a ton. I don't remember exactly what I ate, but I do know that it had a lot of parsley. It might even have been some kind of a parsley salad. It took me 2 years after that to eat parsley again. Oh my God, I was so sick by that night after my first chemo. So my second tip is, if you haven't done chemo yet and you're destined, don't eat, or eat lightly the day before, because it is coming, and to have kind of a pretty much an empty stomach will be an easier transition for you. So that's kind of it on the first batch of chemo that I had. I go from there into surgery, and then from there I go into more chemo, and from there I go into radiation. But we'll talk about each of those in individual pieces. So thank you for joining me today. Please, like me, hopefully, if this has been beneficial to you. I'd love it if you would subscribe, and even more so, I would really love it if you know of anybody that's in this time in their life that you would share these videos. I would appreciate it. I'd like to be able to offer my help and inspiration and message of hope to as many people as possible. So share, and comment. I really would like to hear from you, and tell me what you've got going on with you, what brings you here today to watch this video. So in closing, take good care of yourself. Take care of the ones that you love. Be well. Aloha.